Greetings, my name is Dr. Joseph Ross, and I'm here to introduce tonight Dr. Ken Hoffman, who's an alternative healthcare physician at Sophia Medical Center in Brookfield, Connecticut. Dr. Ken Hoffman practices Chinese medicine, and he's going to share with you the difference between Western medicine, as most of us experience it in America, and alternative healthcare, which much of the rest of the world sees as its primary healthcare, and much of America is beginning to learn and get excited about. Here's Dr. Ken Hoffman.
Hi, my name is Dr. Ken Hoffman. I'm the Medical Director for Sophia Natural Health Center, and tonight I want to share some information with you regarding some of the education that I do for my patients that I found to be helpful. You know, one sobering statistic that I think is important that people know is that if you look at the money that's spent in healthcare, we spend $100 for treating disease and as opposed to $1 in prevention. And the question is, why does that happen? Well, the first thing that's important to know is that there's a difference between the focus of a holistic or alternative medicine practitioner and that of conventional medicine. It's not necessarily bad, it's just that the focus is different, and I want to share some of that with you tonight. So the first thing that I want to tell you is that in order to understand this, we have to look a little bit at the history of how Western medicine evolved. You know, if you took and looked 400 or 500 years ago when Western medicine was just evolving, there were two real core problems that they dealt with. One was infection and the other one was trauma. So you would deal with things like, you know, if you're in the field and you get trampled by a horse, the doctor would have to somehow fix your body. Or if you get a cut, you get an infection and you die. Well, doctors were living at a time during the time with the bubonic plague, and many people were dying of infection, and many times there were two people in the room of a dying person. That was the doctor and the priest. And unfortunately back then the priest won quite often. Well, that became a focus of Western medicine, where what their goal was really to prevent you from dying, which is a noble cause. And as medicine has evolved over time, that was really the focus of the medicine. So, for example, so as medicine evolved, they evolved in such a way that really the focus of treatment was in treating disease like infection or sepsis, or treating grave situations where the person was at the risk of dying. So it's very important to know that if we look at the training of a Western medical doctor, they spend 4 years, arduous years, training in the different disease diagnosis and the treatments through surgical or pharmaceutical interventions, and then they go on to their training. And when they go to their training, the first place that they go is the emergency room. And I had a good friend of mine tell me that there's 3 ways to get out of an emergency room: to go up, to go down, or walk out the front door. It's emergency. People are in dire need of medical care, and they save lives. After that, the doctor then rotates to another place in the hospital. And we all have to admit that the people that are in a hospital are usually pretty sick. If you have to go to a hospital and you have to stay there, you probably have a problem that you need a conventional medical doctor for. Now, the other problem that we found in medicine is that, or the other issues dealing with medicine is also that things usually change very slowly. And we've seen that by seeing the history of how Western medicine has evolved over the years and consumed other types of medical treatments. The example I love to use about this is the one about Elizabeth Blackwell, who was the first female doctor in our country. Now, of course, they wouldn't let her into medical school because she was a woman, and when she finally got in, she graduated 3rd in her class. After that, they wouldn't let her practice in a hospital because only men were allowed to practice in hospitals. So what she did was she opened up her own hospital called the New York Infirmary for Women and Children. And in a very short period of time, she had one of the lowest infant mortality rates in the country. And the male doctors were asking, well, what is she doing? What is she doing that's saving all of these lives? And they went and asked her, and what she said was something profound for its time back in the 1920s. And that was, she said, I require all of my staff to wash their hands in between patients. Well, in 1920, there was an article published in the New York Times Magazine where the title said, "First female doctor insane. Believes she's saving lives by washing hands." Well, now we all know today that she was right. However, if you go to modern hospitals today, what's the main issue that they deal with infection is hospital-borne infections. And did you know that statistics show that less than 50% of all doctors and nurses wash their hands in between patients? So it's a problem that we knew about 100 years ago, and it still hasn't changed that much. Now, I want to say that I'm not saying that Western medicine is bad. In fact, I believe that if you have infection or trauma, they are experts at this and have become quite adept at being able to treat people with these issues. Now, I practice a medicine called integrative Chinese medicine whose roots go back 4,000 years. Now, the whole focus of that medicine was completely different, and I'm sure that if you look into other alternative medicines such as homeopathy, naturopathy, you would see this long tradition where the goal was really not to save a life, but it was actually to try and keep people well before they get unhealthy. Now, what I found in practicing for almost a decade now and seeing and treating doing over 17,000 treatments with acupuncture and Chinese medicine is that there's really, for us, 4 main substances that keep the body well. And this process that I'm going to share with you was not just for the general folk, but that Chinese medicine was actually founded for the emperors of China. It was founded so that they could live well into their hundreds and they could still do all of the things that emperors do with health. And in fact, the doctors had to keep the emperors healthy, or, as you know, they'd be in big trouble. Maybe they'd be beheaded or they'd be rousted out of the village that they were working in. And there's also some knowledge from ancient times that if the doctors didn't keep the villagers healthy, that they actually didn't get paid. So they didn't get paid until the village was well. So the whole philosophy of integrative medicine was much different than it is with a more allopathic medicine. But here's the 4 substances that we believe are important for keeping your body healthy. And it looks like this. Okay. Now, the Chinese doctors believed that you had a substance called qi, which I'm going to get back to. They also knew that the body had blood flow. Besides blood flow, they had an integral understanding of the nervous system, the electrical system of the body, and they also knew that the organs, being the factories of the body, were fed by blood and something called qi. You might be surprised to know that 900 years ago they wrote a textbook that actually had the weight of every internal organ per gram. They had an in-depth knowledge of anatomy and physiology back 1,000 years ago. And what they said, and they said that these substances were critically important for the body to function at 100%. Now let's talk about qi for a minute, because I think that this is a little bit misunderstood in the West. The word qi in Chinese actually means vital air. And when the and now you might have heard this term to mean energy or intrinsic energy, or some people say, oh, I've heard the word tai chi. But the fact is that what the doctors were talking about was the vital substance in air. They were talking about oxygen. And what they said was that when there's proper oxygen and blood flow to all areas of the body, that the body would be functioning at 100% and you would be healthy. They knew that it fed the nervous system, and that this blood and qi flow, or blood and oxygen flow to the organs, made all of the factories work better too. The factories of the body work better. And when the body is functioning at 100%, we know that the body is then in balance. And when the body is in balance, they said it was at ease. And that when the body is at ease, that is a state of health. Now, the World Health Organization today agrees that health is not just the absence of disease, but that it's actually the balance of both physical, mental,